This, however, isn't the first time that Telangana government has not been up to its task in fighting the COVID situation. In May, the Telangana High Court had pulled up the government on its COVID strategy. Later in July, the court rebuked the state government for misleading the public and fudging COVID numbers. The court also had to step in last month and ask the government to ramp up COVID testing. Big question marks of the KCR government's handling of the COVID situation, but will the government swing into action and come out of denial in handling the situation at hand? So the COVID handling of by Telangana government has always raised a lot of questions. I'm going to discuss with Abid Rasul Khan, TRS leader, Abhishek Jagini from BJP, Dr. Sri Bhushan Raju, Professor and HOD, Nephrology Department from NIMS. Good afternoon and welcome to the show.
Yeah, good afternoon.
So we can hear what, we just heard what Itala Rajender, the Honorable Health Minister, spoke to media yesterday. And of course, he's completely in denial. He says this virus is not fatal. Do you agree, Doctor?
Yeah, so far whatever the literature and the data and information which we gather from the sources, so it appears to be a simple routine variant of COVID-19 virus, and it appears to be the one which is not so fatal also at the same time. And it is, though that computational model said that it is 70 times more rapid in spreading from one person to the other person, but it is very unlikely that so far it has been there since September 2020, and it would have actually caused further escalation of this across the globe, especially in Britain, not just in the month of December, a few cases being increased in that country, and even in fact in India it is actually decreasing. You know that for the past 3 to 4 months, lakhs of people must have gone from India to UK, and people must have come from UK to India, but there's hardly any increase in the number of cases in India, especially in the state South India and especially in Telangana. So I don't feel that this is going to be spread when if asked.
Doctor, sorry to interrupt, because I was talking to other doctor yesterday. He said once the spread happens, anybody who is in the who have comorbidities, they will have a problem. They will continue to have a problem because see, if someone has a history of illnesses, they will be at a risk, right? Just like COVID.
Yes. See, that doesn't depend on the variation and the genetic mutations. Mutations are very, very common phenomenon as far as antigen shift and antigen drift, which is there's nothing new with the COVID virus. The COVID also can have similar kind of antigen shift, antigen drift. Only thing is that some mutations are active, and the virus is to deteriorate its activity and pathogenesis, and slowly the effect of virus will get nullified. So we don't have to worry about this particular virus at all now, and especially this particular variation.
Okay. I will quickly go to our other guests, Abhishek Jagini from BJP, the spokesperson, and Abid Rasul Khan from TRS. First to you, Abhishek Jagini, we saw how, High Court had to intervene a lot of times from the time COVID was identified in Telangana. In fact, the first COVID wave, when it came in, the first case was from Telangana. We were in denial. Of course, the patient was from Karnataka, but he interacted with the people in Telangana. His death happened in Telangana, but we kept denying it, and then suddenly we saw cases, and then of course what we saw was after a period of time, there was a lot of denial, right from testing to the handling. A lot of times the High Court had to intervene.
Yeah, hello Revati. Like you rightly said and pointed out, right from the inception of this issue, the government of Telangana has been very negligent and reckless in dealing with this pandemic. It costed us dearly. The High Court on several occasions had to intervene. It had to ask them to increase the COVID testing. It had to ask them to provide proper facilities, not to fudge the data, not to fudge the numbers. I think there needs to be a serious approach from the government.
Yes.
We have our Dr. Sri Bhushan ji, who has given a very good input. This calls for us to maybe relax a little, but yet we should not miss out on being cautious, because prevention is always and any day better than cure. The government, at least on its part, needs to be prepared and not be in a denial mode. There is no harm in actually preparing and, getting up, its machinery.
Mr. Abhishek Jagini, if I look at what the health minister spoke, he clearly says there are no cases of the new strain. But the central government did give a report saying that there are 2 cases. In fact, these 2 cases are from Warangal. One person travelled and came, and his mother, 71-year-old mother, is also sick right now with the new strain. Both of them are getting treated at Warangal. But I clearly know, seeing from what the health minister spoke, he is very clearly in denial again.
See, Hyderabad and Telangana have predominantly dry climate compared to Chennai, Mumbai. We have many positive factors to actually fight with COVID. But right from if you see, those other states had to suffer more. Luckily, our climatic conditions were favorable to us. But the out of sync, the problem I identify is that the state government is not in sync with the central government. The directions and the guidelines of the central government have been always overlooked by the state government.
Yes.
Moreover, another important point that I would like to bring to the information of our viewers is that guidelines of the Ministry of Ayush have been totally neglected and not implemented by the state government. So there are several such things. When an institution like the World Health Organization is able to recognize and start its international center of R&D in India for traditional medicine for COVID, when our states like Tamil Nadu and Kerala are able to give traditional medicine, the government of Telangana has neglected this. It has totally been out of sync with the central government. Like you rightly said, it is constantly in this denial mode. This won't work. We cannot keep our people at risk. They have already done enough damage. At least now they need to wake up and take responsibility.
Yes, definitely. Mr. Abhishek Jagini, thanks for joining us. Yes, clearly Telangana government seems to be in denial. We saw how Karnataka has upped its game and taking all necessary precautions. In fact, entire country, the central government gave an alarm and said that necessary precautions should be taken. But what's happening in Telangana?